So the history of sanitizers is very interesting. To the right is a picture of Lister, who who developed the use of carbolic acid for sanitizing hospital instruments, and we'll discuss a little more about Lister in the upcoming slides. Well, there have so throughout history, humans have been trying to use different techniques to reduce the spoilage of meat and to prevent the growth of microorganisms in foods. So these there are many methods that have been used. These include drying, salt, sugar, resins, and these were used as methods of preservation. People also use copper vessels, which have been known to have antimicrobial activity. Even silver is known to have antimicrobial activity. In fact, even now, if someone has a burn, the first ointment that they suggest is colloidal silver. And then Joseph Lister, he suggested the use of carbolic acid, which is phenol, which was used to dress wounds. And this was one of the pivotal moments where people realized that they could use uh, chemical agents to reduce microorganisms. Judy Javel was the first hypochlorite that was described in 1774. This was basically used because of the stench of big cities such as Paris, New York, and London. There was no sanitation in these cities at that time, and people did their business, collected them in cesspools, and they would fling them out in the streets, or they would let the cesspool into rivers. So rivers were highly contaminated. Streets were uh, not the best smelling streets in the world, and people started looking to see what kind of chemicals they could use to reduce the bad stench. And out of necessity came the use of hypochlorite because it would reduce the bad odor. But hypochlorite also, as we will see in further slides, has antimicrobial activity. Chlorine was first used in US to disinfect pools, and ever since has made its way into water for washing produce and other activities in food safety. So one of the pioneers in epidemiology and someone who helped develop this idea that you could use chemical sanitizers to reduce microbial load was Ignaz Semmelweis. He's the pioneer of hand washing. Hand washing, believe it or not, was not a common practice amongst healthcare workers. He observed that puerperal sepsis, or that caused maternal mortality, uh, was most attributable to people not washing their hands. So he did a study where he looked at two hospitals, and he found that there was significant differences between the hospital where people wash their hands after working with cadavers in the morgue and then treating patients, versus the ones where people did not wash their hands after treating cadavers and then working with patients. He also noticed that doctors and medical students often went directly to the delivery suite after performing autopsies, and they had a disagreeable odor on their hands despite hand washing with soap and water before entering the clinic. So Ignaz Semmelweis suggested that they use chlorinated lime to wash their hands. Though this worked really well in reducing infections amongst pregnant women, the idea was not, he was very unpopular because it was forced upon the medical community and they did not agree with it. The next pioneer that who actually helped us understand that chlorination of water was a good idea was John Snow. Though he did not directly study or work on the chlorination of water, John Snow was an eminent epidemiologist who noticed that during the cholera outbreak in London, in the Soho district, people who got water from a particular hand pump had a higher tendency to fall sick because of cholera than people who lived further away from that hand pump. So he did his first epidemiological investigation by mapping out how many people who were close to the hand pump fell sick, and he found that as the radius increased, the number of people who fell sick decreased. And then he was able to stop that outbreak um, basically by getting the hand pump locked. Through his studies, they found that people who got water from the River Thames, um, when it was closer to the city, it was more contaminated, tended to fall sick quicker, versus when it was further away from the city, less people fell sick when they collected water from those sources. So we realized that Vibrio cholera, the causative organism for cholera, would actually travel through water, and that treatment of water, and from based on his observations, the treatment of water became an important way for us to fight the spread of not only foodborne infections but also human associated viruses like polio. So chlorination of water became a really important part of our society, and this is thanks to pioneers such as John Snow. And finally, we have to thank the father of surgery, Joseph Lister. So he's known as the father of surgery because he noticed that the doctors would basically use the same instrument from one patient to the other to probe and check their wounds and their pus-filled wounds, and they would not clean it. They would just store it and reuse it over and over again. He also noticed that lab coats and bed linen were never washed, and they were just cleaned prior to being put away, but not washed from use from when one patient used them, and then another patient came to use that bed. So he started studying deaths because of amputations caused by fractures, and what he noticed was when they used carbolic acid, which is an antiseptic, on surgical wounds, the number of deaths decreased significantly. So he suggested using carbolic acid for cleaning, not only cleaning wounds, but also cleaning instruments that could transmit bacteria because of cross contact. And this practice of using an antimicrobial agent, in this case it was a disinfectant, on the surfaces, and this prevented a lot of infections. So these are the people, these are the pioneers, the early pioneers of antimicrobial use, and it's because of, and actually we still depend heavily on chemical oxidizers that were used 100 years ago to keep the streets of Paris and London stink free. We still use them on our foods.